Assalamualaikum warahmatullahi wabarakatuh. My name is ZAIREEN FARYZAH binti Zaimy with metric number H19A0595 from class group L2. Today, I want to present my individual assignment, which is critic report for subject concept and trends in tourism. To complete this report, I choose topic medical and wellness tourism and find the sources of article from the Star bernama and journal. Firstly, for the introduction, medical tourism refers to people traveling to another country for medical treatment. Previously, this usually referred to those who travel from developing countries to major medical centers in more developed countries to seek treatment that was not available in their own country. However, in recent years, it has also been used to refer to those who travel to developing countries for lower cost medical treatment. There are differences between medical agencies around the world that decide whether a drug is approved or not, such as the Food and Drug Administration and the European Medicines Agency, which is also known as FDA and EMA. Even in Europe, although therapy protocols may be approved by the European Medical Agency (EMA), some countries have their own review organization to determine whether the same therapy protocol will be cost effective. So, patients face difference in therapy protocols, especially in access to these drugs, which may be explained in part by the financial strength of health system. Health tourism is a broad term for travel that focuses on medical treatment and the use of healthcare services. Health tourism covers a wide range of health-oriented tourism, from preventive and conductive health treatment to rehabilitative and curative travel, as well as the related and appropriate fields for things like this. Next, we move to explain the critic report medical tourism. Healthcare is one of the major business, and until recently, it falls behind so many others in the acquisition of outsourcing. Immunization is a worldwide success story in terms of health and development, saving millions of lives each year. Vaccine minimize the chance of contracting a disease by enhancing your body's natural defenses. However, despite the technological advance in hospital management, we know often issues occurring in the medical sector that can affect the patient and hospital staff. Among the issues that often occur in the medical sector, like investing too much money in technology and even vaccine and so on. The health business is dealing with several issues, including one that requires a significant financial commitment. This is because if a government of a nation wants to establish a health tourism business, the process of doing so necessitates a substantial investment. For example, Gleneagles Medini Hospital Johor, which is well known for its private healthcare facilities, is investing heavily in the medical tourism sector to improve service quality and deliver safer and more up-to-date treatment technologies. As a result, the government will have to invest billions of ringgits to purchase beds, breathing aids, and other necessities. Moreover, the healthcare fees that will be levied on the public will be exorbitant. For example, the rise in non-communicable illness caused by sedentary lifestyles, stress, and an imbalanced diet need medical attention for a growing number of individuals. To avoid this, the government should conduct frequent reviews of medical service to avoid charging people exorbitant fees. Relevant parties such as the Ministry of Health and the government, for example, collaborate with chosen hospital networks and healthcare providers to deliver excellent treatment at the lowest possible cost to impoverish patients. Individuals should consult with their physician and family members ahead of time about the financing of medical expenditures that will be incurred before electing to seek health treatments at a medical center. They must also select a medical package that fits within the money that has been allocated to them based on their ability. Furthermore, a country expansion of health tourism would be slowed by a lack of an experienced personnel. This is because in this difficult time there are several elements that need the service of professionals to treat. Nonetheless, there are other requirements that must be met to become a medical expert. As a result, the community will be forced to seek care in medical centers located far away from their homes. This is because most medical institutes lack chronic pain experts. For example, there is scarcity of mental health professionals and workers. Currently, Malaysia has just 420 professionals in the field of psychology for a population of 32 million people, which need be increased by 800 to 900%. Additionally, nurses and social workers in the field of mental health are in limited supply. The conclusion is, as a result, the government will be forced to spend billions of ringgits on beds, bedding assistance, and other requirements. A shortage of skilled professionals would stymie a country's growth of health tourism. The government should enlist the help of well-known medical specialists from other nations to instruct healthcare staff. A well-developed healthcare infrastructure is essential for a country's health tourism industry to thrive. Thank you.